This is actually a great question and something of a controversial topic. For those of the audience who are not familiar with what this question is about, basically ACE inhibitors are a class of drugs that are widely prescribed for conditions like hypertension and for congestive heart failure. So we have a lot of elderly persons in the community who are taking ACE inhibitors. Why is this a problem? The cause of COVID-19, which is the coronavirus SARS-CoV-2, actually uses the ACE to enter cells and to infect cells. So the target of the drug is what the virus is using to enter the cell. Now, what effect does this have on SARS-CoV-2 when you're actually taking an ACE inhibitor? To cut a long story short, we basically do not know at the moment. There have been some scientists who have postulated that taking ACE inhibitors might worsen SARS-CoV-2 infection. However, there has also been some evidence to suggest that taking ACE inhibitors might protect persons from severe SARS-CoV-2 infection. So from a theoretical perspective, there is both theories have been put forward. There is some evidence out of Shenzhen in China that elderly people who take ACE inhibitors may perhaps have a trend towards less severe disease than people who do not take ACE inhibitors, taking other drugs for hypertension. So at the moment, we do not have a larger clinical trial to look at the effect of ACE inhibitors on SARS-CoV-2, but these are actually already ongoing. So that answer should hopefully be settled within the next few months. So what do we do in the meanwhile? If you are taking an ACE inhibitor at the moment for a chronic medical condition, continue doing so, because stopping it or changing to other drugs might cause fluctuations in your control of hypertension or congestive heart failure. And if these conditions, chronic medical conditions like hypertension or congestive heart failure, are not controlled well, then you are actually putting yourself at risk of severe COVID-19, which is worse in these groups. If you have any doubts, do talk to your healthcare provider and they will advise you on whether any adjustments to your medications are required.